when we talk about high risk patients, right, who are with coronavirus, who are high risk, what's considered high risk?
You know, so the data that we're getting already on the cases, you know, and it's being revised, things are being churned out every day, reports.
Right.
But so far, one indicator is already kind of what I was talking about, the pre-existing conditions, you know, heart disease, lung disease, cancer. Again, those keep coming up because obviously they impact everything, you know, that you're going through, resuscitation, intubation, all. So any of those pre-existing conditions, depending on which condition it is, it can confer a 5 to 10% additional risk of mortality with the coronavirus. But one thing that we're seeing that is very dramatic is age, actually. And there are a number of, you know, there are a lot of numbers out there, but the thing that I would want to focus on is above 80, we're seeing that the mortality rate is 14.8%. So that's close to 15%, 1.5.
Yeah.
That is a very high number.
Yeah, that's a pretty high number.
Yeah, and I think, you know, and there's some new data. There's something one of my colleagues sent me today that I was looking at, and it even seemed like of all people who go on to ventilators and breathing machines for the coronavirus, about half of them are successfully coming off of it, only about half. So like I said, this is a very, you know, changing picture, new information every day, but we've already got some good you know, some parameters to go by. Now, there are other things that the doctor will consider, obviously, not just, you know, age being a big one, as I said, pre-existing conditions, how severe of the infection you have when you present, you know, are you already, do you have the low oxygen levels going on? And is the infection so overwhelming that other organs in your body are also already being compromised? So they look at, you know, lab work, kidney function, liver function, putting it all together. The doctors will be able to stratify you into sort of the, you know, the groups that you were talking about, the high risk, moderate risk, and the low risk of dying from this disease.
Right.